ask her how she get it. Made a couple racks, I never asked her how she get it. City girls love to have fun in the city. City girls love to have fun in the city. City girls love to have fun in the city. City girls love to have fun in the city.
Welcome to episode 2 of Connect with Christina. I'm extra excited to have our guest today, especially after last episode 1. This doctor does a lot of great work in our community. Please help me welcome Dr. Chris Ray with Southwest Wellness Group.
Thank you for having me.
Let's dive right into this because I'm excited about the topic we have, only because I know that we'll be able to reach a lot of people and really help them out. So
I'm Dr. Christopher Ray. I am originally from Houston, Texas, and I've been here for almost 18 years now. So our company, Southwest Wellness Group, is a wellness clinic that focuses on addiction, pain management, and the overall wellness of patients.
how did you get started in this field?
Well, interestingly, I'm an anesthesiologist by trade. So
Wow.
I've been doing bread and butter, standard anesthesia for years and years, but as you probably know, if you went to the hospital, or anybody you know that went to the hospital for a procedure, your anesthesiologist generally is your acute pain doctor as well. It means they would do the block for your orthopedic procedure. We manage your pain for surgery. And so anesthesia and pain are kind of very interchangeable in terms of the treatments that are provided. So I did anesthesia for many years, and then I left actually the field of medicine for a short period of time to do IT. And
Wow.
I built what we call
Overachiever.
I know, a little bit, just a little bit. I built what they call electronic medical record, and so after completing that project, I came back into anesthesia, but then I went into mental health. Mental health, essentially for two reasons: one, for pain management, and one, because our community had a big need for the treatment of depression, as well as the detoxing, as well as the reduction of medications that people were taking for opioids. And in this process, it began to flourish, grow, and I branched out and started doing more things, including pain management. And so it's been a great opportunity. I've loved every day of work that I'm blessed to go to. And what I do now is essentially a blend of anesthesia, pain management, and addiction.
Wow, that's a lot. I'm just glad that you put emphasis on this area too, just because a lot of people really do need this help. Can you elaborate a little bit more on the addiction side?
Absolutely. So, as we know, let's just deal with two things for a moment. Let's deal with alcohol and opioids. When coronavirus essentially happened, it caused an explosion in the sale of alcohol. And alcohol sales went up about 60 to 70%. The number of opioid addictions, as well as opioid overdoses, skyrocketed almost 20%. The number of overdoses went up in 2020, as well as it began to go up in 2019. So instead of going the right direction, it went the wrong direction. And
Those are staggering numbers.
the numbers are absolutely staggering, as well as not only because remember, we only recognize the people who sought help or the family called for help. So anyone
That's true.
who
true. You don't
had-
even think about that.
who had a hidden event, or some other family member rescued them without calling 911, that's never reported. So the numbers are much higher than what we believe. And I felt a sense of importance, a sense of that was calling me from the community, as well as with related to my family, as well as a sense of responsibility that each provider has to reverse what we have seen happen over the last 10 years, and that's this explosion in addiction. And I think that the onus is on all of the medical community to help reverse this problem. And so the way I do it is by helping people detox from medications, as well as helping people with depression and helping people through addiction. You know, I do it through outpatient fashion. There's two types of outpatient: invasive outpatient and non-invasive, which is more of a what we call medication-assisted treatment. So I use various medications to help patients not only get off but stay off these addictive medicines that will change not only their family, it will change their relationship with their kids. It can destroy their
Everything.
jobs, everything. And so, what we're doing is restoring the community when you save even one person from this
That's
addiction.
so true.
And so, once you see this sense and feel this sense of wanting to change and empower families and empower people, because you never know what got a person to that position
That's
that they're in.
correct.
And it's not my position to judge, but I want to understand so that I can help them as well as help somebody that I see that's in that same position. And people don't even understand that there's a gene associated with addiction. And they may not know that they had that gene until they had a particular surgery, procedure, or injury
Wow.
that triggers it. And then all of a sudden they'll realize I have a problem.
I didn't know that.
So it's important that that people understand and become educated to what is happening to them, why it's happening, and then as I see a patient, a family member, I teach them that this is not about just the patient. It's about the family, the support system, and everything that is going to allow them to reestablish themselves back in the community and become, the person that they really wanted to be, the person they see themselves as.
Well, and I think that's the key for me is that I think we have a social responsibility to do our part, And the guest that I had last week on the episode 1, he was a heroin addict and served time, was really lost in a dark place. And then fast forward to now, he's a very successful, mortgage broker. So with the right help and the right treatment, the right support, and learning about people like yourself, doctors like yourself, that there's hope for these people.
Absolutely. And that is a success story that we hope to hear more and more often. And I think that, with a gentleman from last week, I'm so glad that he was brave enough and courageous enough to share that story, because there are so many people who are just looking for someone who could tell their story, who could say, you know what, today's the last day, and they're going to have a breakthrough. And they're going to reach out to family, they're going to reach out to us, and they don't have to reach out to us. They can reach out to any location that treats addiction.
Sure.
And we just want them to be better. We just want to ensure that they can protect their lives.
Right.
But what we find is that there's only two options if they don't. They're going to be dead or they're going to be in jail. And so we want to help them to prevent them from going down that path. And when those two things happen, they lose everything else in their lives, their finances, their family, their kids, their relationships, their jobs. And so we try to get them to understand this cascading event that begins to occur. And as you probably noticed and you've talking to people, it is so frustrating for the families, and they have given
Yes.
so much. Sometimes they have financed their recoveries, and
They're in so
unfortunately,
much pain. They love these people.
absolutely,
you know?
they would give anything for them, and unfortunately, the nature of opioids and alcohol causes people to relapse at a much higher rate than anything else, and so people will have sacrificed everything and they relapsed, and the patient relapsed.
I think this situation or this, issue here, and I know it happens in every state, but it's so real. And, for anyone that's going to be watching this episode, if we could help one person, it would be just...
It would have made the difference.
Yeah. And you brought up relapse. That's like one of the things that I wanted to ask you. How you said it's often.
Yeah, it's over 50%. And so you can imagine if you take 4 people, almost 3 of them will relapse. So
Wow.
So the number is very, very high, and so we have to. That's why it's so important not to just simply detox a patient off of medicine, but to change their behaviors, their mindset, their attitudes. That's why psychological and their psychosocial changes that begin to occur within their family, themselves, their community, all those things have to change, because you can't just switch cars and still think, hey, everything's going to be different. Sometimes you have to switch your route that you would drive to work, the clothes that you wear, the contacts in your phone, everything has to kind of change, and you begin
Even
to
the people you're
absolutely.
around.
You have to understand what are your triggers, what stresses you and causes you to make bad decisions. And these are important things that counselors begin to dive into your life and help you understand these things. And people like myself provide the medication that helps bridge you off of things that destroyed your life onto medicines that'll keep you stable, and then onto 100% sobriety. And because that's the goal. Our goal is a 100% sobriety, and let them recapture the life that they want and they want for themselves and their family.
And I would love for you to kind of go over that, that area of practice that you have, because again, I think that this will really help a lot of people. But I wanted to touch on the fact that there's a lot of like parents, or especially parents, because out of that love, I mean, this topic is so charged because these are people you love. It's someone's dad, someone's brother. And I think like the hard part too is like, they don't mean to enable, but out of love they think they're doing the right thing, but they're not. And then like you find tough love. It's
Absolutely.
Hard.
Absolutely. You see a combination of different things. You've probably seen parents who enable them through love, and they allow their child to do the things that they wanted to do because they may have been a single parent, and they don't understand the dynamics of the relationship. There could be so many different things, and then you see the other extreme where it is an ultimatum. You're gonna do this, or this is going to happen. But sometimes they don't understand that addiction is a disease, like anything else, and you can't always rationalize with the person at that time because they're not in the frame of mind to think and rationalize with. You're not always talking to the person that you knew 2-3 years ago.
That's true.
At that time, that person kind of lives and serves for that drug or that thing that they need. They plan their life around it, their finances, what they're going to take, what they're going to steal, all based on that addiction.
Right.
And understanding them and understanding their addiction will help you to better assist and help them, instead of judge them and get angry with them.
I think it's interesting too, just like you said, just to educate as many people as we can that there's really a lot of different, things to consider. So for a person that's going through this right now and they want to sign up with you and explore their options with you, like what does that look like?
Okay. So if someone, if you're even considering it, I always just say first step, just reach out and call. There is no charge to talk to you, to tell you what your options are, because what we want to do first is think of a person almost like I don't mean to undermine it, but think of them like a car. We need to ping them. We need to figure out, where are you in the United States? Are you in Texas? Are you in Oregon? Are you in Florida? Not just physically where are you, but from an addiction standpoint, where are you? How much do you use per day? How is this affecting your life, of your finances? Are they using IV drugs, pills? What are they doing? Are they have a weekend cocaine habit? Are they a binge drinker? So when we understand where they are, then we begin to understand if they need inpatient treatment, or could they do outpatient treatment. Some patients, we said, based on where we understand you're at this moment, and how many times you've previously relapsed, you need inpatient treatment. And I don't want to provide or charge you for another failed outpatient treatment. That's what you need. And so it's that honesty with compassion that says this is what you need.
I can tell you care.
Yeah.
You scream that. So I am excited that you're here. For sure.
And then secondly, after we figure out which one they qualify for, we have a group of companies out there in the valley that we will refer to if they are an inpatient or an intensive outpatient type of patient. They need IOP, that's intensive outpatient, or they need inpatient. If they need either of those two, we refer the patient to the facility that can provide that. If they are a candidate for medication-assisted treatment, that means that this patient is abusing a drug but the amount they're abusing is low enough that we can manage them as an outpatient. We can get some corrective behaviors around them, and we can provide therapy or drug that will get them off of what they're currently using. Then we call that onboarding. We will onboard the patient, and then we'll get them off that medication, off that drug that they're on. And we will help detox them or whatever they need. And then while doing that, we also provide we refer them or provide the counseling for them that they need through this process. Okay. So then at that point, we continue the patient on the medicine until we wean them off or they choose a different alternative. For example, there's medicine called Vivitrol. And so let's just say we got a patient off of an opioid, and now we give them a shot. And that shot goes into a deep muscle. Generally, we put it in the buttocks, and it goes once every 28 to 30 days. And it lasts once a month. And every month they get that shot, and it prevents them, if they try to drink alcohol, they
what
wouldn't get the
happens?
buzz from it. They won't, because alcohol also affects a receptor in the brain called a mu receptor. So they won't get the same buzz or feeling, but they'll feel sick from it.
Okay.
So that's no
They're not
good
gonna
for
want
yeah,
it.
that's no good. And if they were using an opioid like heroin, cocaine, Percocets, or anything of that nature, they will not. The medicine will be blocked. So it's the same thing as if the person had Narcan. And so we can provide a 30-day dose of Narcan. And if they decided they wanted a longer dosing of it, the reason I brought up Vivitrol, I would offer the FDA approved treatment is Vivitrol, which is the injection.
Okay.
The non-FDA approved, but we know that it's a very effective method, is we would implant the patient with naltrexone. Vivitrol is naltrexone.
Wow.
And we have also naltrexone implants that we can put in the patient. And that will last for almost 6 months, 4 to 6 months. And so generally it'll last closer to 6 months, but it depends on the patient's individual metabolism. And so now if you can imagine a patient, I'll always say I'd never want to demean anybody, but think of it like an elephant that was at a circus. And initially when they got that elephant and they put a chain on its leg, it pulled at that chain because it knew and it thought it could break the chain. But eventually the chain mentally broke the elephant. And now they can take the elephant to the circus and put a little tiny rope on it. And it will look and notice something is around its foot.
That's true.
Or ankle, and it will not pull. And you've probably seen that. I know
Right.
kids now we don't have circuses anymore. But the same effect can happen with the brain when being implanted or having long-term sobriety. You begin to believe that there's no point. What's the point of me trying
That's
this
such a good way to
medication? What's the
explain
point of me trying that? It's not going to work. I've been implanted. So that's the only reason I do encourage, because the medicine that we do inject can wear off, and they know exactly when it wears off.
I
and
see.
so that they
Okay.
could, if they really, really wanted to. they
So
could
like you
just
said, it's case to case.
Case to case.
What they need after you
Absolutely.
evaluate them.
Absolutely.
Is that invasive, the chip?
No, it's not. It's really small. Well, I would say scalpel's used. So yes, it's a little.
Okay.
We do take them to the surgery center, and then we do make a very, very small half-inch incision, maybe 2 centimeters, and then it's placed right in the subcutaneous fat of the abdomen. They probably can't feel it 90% of the time, but some
Okay.
patients who are super, super thin, they can feel it. Feels like a vitamin pill.
How long is that procedure?
The procedure is 10 minutes.
10 minutes?
Yeah. So 10 minutes for 4 to 6 months of sobriety, I think's a pretty good deal.
Right. So does it if immediately work?
Yeah. So as soon as it's placed within the body, it begins to dissolve, but we know it's going to continue to be absorbed by the body for almost
A
6 months.
substantial time.
And so that is what they need to maintain that complete sobriety, 100% sobriety. And then at that time, they also begin to start working on their behavioral changes, begin to understand what their triggers are, and they're able to, that's how I personally feel, and other doctors feel this way as well, is that when they're able to maintain long-term sobriety, we get them 1 year, a year and a half, then you increase the risk, you increase the patient's ability to stay sober and decrease their risk for them to relapse.
Relapse.
So
Do you notice or have you noticed any type of psychological or emotional change when you do when you implant the medication?
Not necessarily. The hardest part is giving it to someone who actually wants it. So a lot of times people, we have to ensure that the reason you sought treatment is because you want to be better and not because
That's
your husband's going to
huge.
divorce you, your wife's going to leave you, your family, because you're not ready.
You're not going to
know
be
it.
committed.
You're not going to be committed, and you probably don't want something that's going to block you when you know you want to, go to the summer's coming up. I'm not going to be able to have enjoy drinks, wine, such and such. But you, instead of having a mindset of I never want to touch alcohol again,
Right.
and so that's a hard thing for a person you have to understand they have a relationship with this drug,
It's different, right?
and the way they interact with it is different than the rest of society.
That's just a powerful thing to say. That's so true, and we all kind of
yeah.
live our lives. We're busy,
Absolutely.
and I don't think that that's something that we think of.
Yep, absolutely. And then when you begin to understand it, you quit kind of judging and being so frustrated, and then understand this is who I'm dealing with. This is the person. This is their disease, as if it was hypertension, diabetes, and understand how their disease is affecting them. Each person can be affected a little different, but it's still a disease.
So the first thing that I want to point out, I think is so helpful is I can tell how genuine you are, and also that you don't judge, right? So you're looking at the person and really want to help. Do you try to explain to, like, say a spouse or a family member that's trying to help, or that this person will be around? Is there things that you tell them, hey, watch out for this, or make sure you support in this way?
Okay, so generally what we want to do is involve a psychologist or psychiatrist or a licensed, Arizona licensed counselor for addiction that gets involved with the patient while we treat the medical and we treat the actual patient with medication to get them off. And we want the psychologist, psychiatrist, or the counselor to focus more on the family interactions, the dynamics, as well as helping them understand what their triggers are. And we let them handle that side of it. From an initial standpoint, we like for everyone to get involved so that everyone knows this is the treatment we're starting. Not everyone, but generally the most important people,
In their
the parents,
lives.
the spouse, yeah. And so they understand that we're starting this treatment. This is what this is what we anticipate. This is what we expect. What's going to be different. And the patients understand when I see you tomorrow, we're going to do a drug screen tomorrow. When I see you the day after that, we're going to do a drug screen the day after that. And so sometimes even though they do have this disease, they don't want to disappoint
Sure.
their spouse. They know they're going to come see me, and they will try to adhere to what they're supposed to be doing. And they're very honest when they'll walk through the door. Yeah, I had a problem.
So, and how long have you been able to do this side of your
Okay.
practice?
So for the last 2 years, I've had a medication-assisted treatment license, MAT license, and it gives doctors and mid-levels all across the country something called X waiver, where we can prescribe. We get a license, an extra license by the DEA to prescribe drugs that can keep patients off of opioids and alcohol. And so that I've had that for 2 years now. And the reason, as I said, but I went into that is because I was doing kind of mental health in terms of treating depression and also detoxing patients off of high dose of opioids down to a low dose of opioids. And I was doing that through what we call a ketamine clinic. And so that was a
Wow.
rapid treatment for treatment-resistant depression or patients who were suicidal, and they were actually better within a week versus taking months and months and months to improve.
That's like a whole different podcast, because
It
I
sure
care
is.
a lot about that, and I think
But that's its
it was
origin.
happening before
Absolutely.
the pandemic, but it just like escalated, and
Absolutely.
now. But I'm really interested to hear about, like, maybe one of your success stories.
Yes. So without getting into too many details, we had a patient that came in and the patient worked in the financial industry, does very well, and they knew and understood that they had a problem, and they were able to just be honest enough about, this is where I'm at. I want to get better, and this is what I want. We were able to start the patient on a medicine that would take away those desires for that medicine, for those opioids. And but what's so interesting is that our staff was so loving, so committed. Talk to the patient literally almost every day, and the patient knew that there was a connection, knew that we were there for them, for whatever their needs were, in terms of medical, how we could help them. And the patient just onboarded amazingly, did well, was able to come off of those medications. And then not only that I swap one dangerous drug for a prescription drug, the next thing I did was say, I'm going to take away now this prescription drug. And so then we do what we call a taper, and we slowly remove that one until they get down to zero. And now they have 100% sobriety in their life, and their life is back on track.
That's amazing.
And this is this gentleman, it did phenomenal, and I wish he could just tell the world his story, but that's just one.
That's amazing. And how did he find you? That particular person, or she?
Generally, we create relationships with other centers in the valley, and some centers may be specially designed for intensive outpatient, or they may be designed for inpatient. So they call an inpatient facility, and they say, no, this one will be better for you.
Okay.
Because you seem to be able to, you probably could do an outpatient. And so we get a referrals from them as we send referrals their way. And so it's kind of like a loose partnership with all of the addiction centers within the city.
For me, I mentioned earlier, I was a landlord for many years, 18 years. And when you run apartments, you have criterias, right? So you have to, say, make 3 times the amount of rent. You have to have good credit. How do you get credit? And then you can have a background. So when people get out of jail or prison, rather, where are they going to go? We don't want them to go right back to where they already had the issues, but we don't have a plan to say, look, you can apply at this community that's a nice place to start over. Sure, you can get a job here, because it's like, that's the truth though. It's happening. So it was an opportunity for me back then to say, okay, I can't help you here. I don't own the place. I just manage it. I have to follow the rules. But here are some resources. So I started building a community of different employers that would help me employ a person right off of coming out.
Love it.
So, I've even done this thing where if they're coming out in 18 months and they need a letter, I've been blessed to have people that want to work with me on helping other people and say, yes, when he comes out, he's going to have a job here, and that So I think that, again, as a society, other than being kind to people and not judging people, I think that all the things that you shared today is just important, and I'm hoping that we circulate this episode to help as many people as possible.
Absolutely, because the first step is to just reach out, and if you a lot of times people have an addiction in privacy, and they in secrecy, and no one really knows that they have this issue, or they do know, but no one's saying anything, and they got to reach out to someone, if it's someone in the family, someone they trust, and if you got to have your best friend, hold your hand and walk through the door, arm in arm walk through the door, and help bring you in, and then there's help for you, or just call to see what are your options are if you know that this is the type of insurance I have, or I don't have insurance, and see what options.
The call is free,
Yeah.
right?
Absolutely.
That part. Doc, I really want to go back to the gene, being a factor in this, because you just taught me something I didn't know.
Absolutely. One of the things that has come about in just technology is for us to do pharmacogenetics and pharmacodynamics. So we can understand if a patient has the potential or is going to be addicted to a particular drug, or there's a high probability. And it can even tell us which drugs that the patient would be addicted to. And so a lot of people can't afford this. These things are covered by insurance sometimes, but sometimes they are not. The tests are under $1,000. But if you think about what it has cost some family, regardless what they've lost, I think it's a small cost to pay to find out, hey, do I have the potential to be addicted to alcohol, Percocet, or any particular type of medication, fentanyl, even though each of us will respond the same to fentanyl if we're undergoing surgery. Certain people will have the propensity to want to have more of it after the fact. And if they could tell their provider, these are things that I have a potential to have addiction to, it will be avoided. You know?
And this is something you can facilitate?
If the patient asks for it.
Okay.
Yeah. But if someone comes in and they have an addiction and they're on that particular medication, I don't necessarily test them to see and verify. I just want now to save their life and get them off of that medicine. So I'll just work on that. If someone wanted to know because they had a family member that has a very serious problem, do I have a gene for that? They could find out.
Okay. And when people tell you, hey, I don't want to drink, I have this, we need to respect that.
So absolutely. And one of the things we do see, remember, the sales went up 70%, the alcohol consumption and abuse, DUIs, everything else went up after that. And we need to understand that alcohol is a drug as well. And while many people can, drink responsibly and have a nice drink, if someone declines, let's please try to respect that there may be larger factors that they're not telling you about for why they decline.
Right. So we need to
I can tell
respect it and be...
Absolutely. I can tell you, my wife, so we were at the bar, and she said she declined. And the bartender says, "You never decline, you're pregnant." And so we didn't tell him. But he was the first person to know.
Oh, my
because
gosh.
we ate at the bar, and she declined a martini. So for everyone has their reasons, and I think it's important for us to just respect the people's wishes.
And before we end the show, for those people that are going through this or have loved ones that are going through this, what would your message be to them?
If they were seeking help, or you're seeking, or you want to find out for a loved one, the hardest part is we can tell you what is available, but it's always best if the patient calls, because we need to know if the patient's ready, or they're open to it. But once the patient calls in, we get an understanding, because generally they're going to be more honest with us than they are with their family. They're going to say how much they really use, how bad it really is for them. We'll be able to tell them what is the best resource for them. Even though they may not have insurance, still call, and we can tell you how to get plugged in, because there are locations that will help you with the immediate application.
Okay.
And help the family and to get onto Medicaid, or and they'll have what they call a Medicaid pending and be able to get into a center. So just because they don't have insurance at the moment does not mean that they are completely ineligible.
Will you let everyone know how to get a hold of you if you have anything coming up? And again, more importantly, how to get a hold of you guys?
Absolutely. So they can always call our clinic at 480-478-0790 or visit our website at azwellnessgroup.com.
Sounds good. Thank you, Doc, for being here again with Connect with Christina. Thanks for having a nice afternoon with us, aka the Clout God. The concept of less institute is less exposure, less invasive, less blood loss, and everything is just less, even your recovery. So for more information, please go to thelessinstitute.com. And shouting out handcrafted earrings by Mel in New York. See these? They're amazing. DM me for more information. Thanks for being with us today. I think you have to cut that out, but that's good.
Never ask her how she get it.